This video is going to show us how to rescue somebody from an opioid overdose using naloxone, which is commonly known as Narcan. The reason we do this here at Don Farm is obvious because we know that clients who enter abstinence or recovery don't always stay there. And we also know that the most dangerous time for someone to relapse is after they've been abstinent for a while, and that includes somebody who has been in treatment or leaves treatment, somebody who's been incarcerated and gets out of jail, or somebody who stops medication-assisted therapy like buprenorphine or methadone or naltrexone injection. This means that you are now sensitive to the drug that you were using. You don't realize it. You go back to using the dose that you used to use before you stopped, and because of this, you overdose and it can be fatal. If you catch an overdose in time, you can reverse it. We want to be ready for this. And we know that public safety departments all over the country, including Washtenaw County, have started using rescue kits and are also being trained to give naloxone. In addition, Michigan has passed a Good Samaritan law that protects anybody who performs naloxone rescue when you overdose. Naloxone is considered to be an opioid blocker. It goes to your brain. It will bind to the spots in your brain that opioids go to, and if there's another drug there, it will kick it out. It will displace or kick out a medication like heroin or hydrocodone, which is Norco, or oxycodone or OxyContin or morphine. It will also kick out methadone. And the problem is with fentanyl is that fentanyl also binds very tightly to the brain, so you may wind up having to give more. For that reason, we're going to have each house or location have at least 2 kits, so you're going to have 4 vials of Narcan to use, and we'll show you how to use those every 3 minutes. And it will work for 10 to 30 minutes until EMS can get there and resuscitate the patient and take them to the hospital. Naloxone does not reverse overdoses from sedatives, and that includes alcohol, benzodiazepines, and those are drugs like Xanax, Klonopin, Valium, Restoril, muscle relaxants, especially Soma, or even overdoses from stimulants like cocaine or amphetamines, Ritalin, or methamphetamine. But if the patient is mixing drugs, and the most likely combination that we're going to see is going to be a combination of benzodiazepines and opioids, it will help reverse the overdose until EMS can get there. We're going to show you all this on the video that follows right after this discussion, but the first thing you're going to do is to make sure that they're actually having an overdose. And typically you would find somebody on the floor who is blue, which means they're not breathing, their brain's not getting oxygen, they don't respond to pain, meaning that you can push on their breastbone or rub under their nose, which is very sensitive. You may even find a syringe in the room, so you know almost for certain that they are having an overdose from opioids. On the video, it tells you to check for a pulse. However, unless you see somebody collapse in front of you, which would most likely be a heart attack, we don't recommend doing this. And the reason for it is that you may very easily miss a pulse, think that you're dealing with somebody whose heart has stopped, and start doing compressions from CPR or for CPR. If you do that, you're not going to be following the protocol that's most likely to save somebody who is suffering from an opioid overdose. So unless you see someone collapse in front of you, go right to rescue breathing after you call 911. Always call 911 first, because in the middle of everything, you are going to forget to call them, and then you're going to wonder why they haven't shown up. So call them, tell them where you are, tell them who you are, tell them that you're starting rescue breathing and giving Narcan. And if you have a cell phone, leave it on speaker. And if you have a regular phone, leave the phone off the hook so that they can continue to hear you and you can talk to them and vice versa. So for rescue breathing, you want to make sure that their airway is open, so you tilt their head back. You're going to have a mask bag in your kit. Take the mask out of the bag and you simply push it open. If the valve is not attached, you put the valve in. You'll see the valve on the video. And then put the mask over their face. Put the strap behind their head. It's like an airline mask. And make sure it's tight. And then start with 2 rescue breaths. And we want to caution you not to give too strong a breath, because it's possible to pop someone's lung open, which would make it very hard to keep on resuscitating them. So give a 1-second breath, watch their chest go up for 1 inch. After you've given the 2 rescue breaths, then you're going to give the first dose of Narcan. So to prepare the Narcan, you're going to have 2 vials in each kit, 2 kits. You take 1 vial, you pop the top off. Don't touch the rubber top because you want that to stay sterile. Take out the syringe and hold the needle up and pull back on the plunger until you get to the 1 milliliter or 1 cc mark, same thing. And then pull the cover off the 1 cc syringe and stick that needle in the vial and push the air in the vial. That makes it easier to get the naloxone out. And then turn the vial upside down and start pulling on the plunger and make sure that the tip of your needle stays in the liquid. And you'll see this when you're doing it. If you just pull above the liquid, you'll get air. If you keep your needle in the liquid, you'll get naloxone coming out. You want to pull back until you get to the 1 milliliter or 1 cc mark. Then pull the needle out of the vial, put the cap back on and pull it off, and you don't have to worry about sticking yourself because this needle is sterile and you're not going to be exposed to any infectious diseases. And then put on the atomizer, which we'll show you in the video, which will help spray into the patient's nose, and make sure their head is tilted back still, and put 1/2 of the syringe in each nostril. If you can't find an atomizer, or you stepped on it or it's gone, then you're going to use the safety needle and you're going to inject through their clothing. So to prepare the safety needle, you are going to be pulling out the naloxone like we just discussed, pulling out the needle from the vial, put the cap on and putting the needle aside, and then you'll see the safety needle, which we'll see on the video, and just pop the safety needle on the syringe and pull the safety cap off. And it looks like a normal needle, except it's longer and it has a large plastic gizmo on the side that will help you to cap the needle without actually touching it. And then take that needle and stick it into the side of their arm or the side of their thigh and inject the entire dose. You don't want to split the dose. Don't try and take their clothes off. Don't worry about swabbing with alcohol. Once you pull that needle off, you're going to see the plastic flange on the side of the safety needle. Just push it down, push it forward, and the needle will cap itself, and now the needle is completely safe. Put that to the side, and you're going to go back to your rescue breathing, and then after EMS has left, you can dispose of that. So after we've given the Narcan dose, you want to resume rescue breathing, and again, you don't want to give too many breaths or too physical a breath. 1 second breath every 10 seconds, you can count to 10, and then you can give an extra dose of Narcan. Remember, you're going to have 4 doses every 3 minutes until they are revived. Okay, so the first thing we're going to go over is what's in the kit. You're going to have a rescue breathing mask, and when you open that up, you'll see a flat mask, and you have to push it out, and the valve should be pointing out. This is the rebreathing valve, and here's the snap. You're going to have a set of latex-free gloves, and we have our own set extra in the kit. And you're going to have alcohol wipes, which you can use to remove any blood afterwards. Inside this light-proof kit, you're going to have a vial of Narcan, and the Narcan should be kept out of the light until it's ready to use. We have an atomizer, which turns it into a spray. We'll have 2 safety needles, and we have 2 TB syringes with regular needles on them. And in the real kit, you're going to have 2 bottles of Narcan. This is 0.4 milligrams of Narcan in 1 cc. So if you're prepping the kit, what you're going to do is pop the top off, remove the cap, and pull the syringe back until it goes down to the 1 cc mark. And then you put the needle in, you inject the air, turn it upside down, and remove the Narcan. And you really should be able to remove a little bit over 1 cc. And then you don't need to worry about bubbles because we're talking about injecting it into a muscle. And You put the cap back on. This is still a sterile needle. You pull it off and you put the atomizer on. And again, you're going to have 2 of these. If you have to use the safety needle, if you don't have an atomizer, you just take the safety needle and put it on. And we're all set.
Okay.
So we've already talked about what's in the kit. Now you find somebody unconscious, you don't think they're breathing. So the first thing you do is check a pulse on their carotid, and it's right in the same location your carotid is. And if you don't feel a pulse, then you would go ahead and start CPR, and we've got a separate video for that. If you do feel a pulse, you're going to start rescue breathing, and before this you should already have called 911 as soon as you found them. And if you can, leave them on speakerphone and keep talking to them so they can give you instructions and tell you how close they are. So we decided we're going to do rescue breathing, so we slip the mask on. You make sure that it's tight, nose up, and you're going to do 2 rescue breaths. And the one thing you don't want to do is, if you breathe in too much air, you can actually cause a pneumothorax and collapse their lung. So you want to only do a 1-second breath, and their chest wall should only move about 1 inch. So I'm going to do 2 rescue breaths. And then I'm going to stop, and I'm going to give the Narcan. Now we already have our 2 loaded syringes. We've got our atomizer. So I'm going to pop off and put on the atomizer, and I'm going to put half the Narcan in each nostril, and then lay the syringe down. And I'm going to go back to doing rescue breaths, and it's going to be 1 breath every 10 seconds, so 6 breaths a minute. So you can count out 10, do a breath, count out 10, do a breath, and if you have somebody else, they should still be, someone else there, they should still be talking to 911. So after 3 minutes, they haven't regained consciousness, so we're going to give the second Narcan, and in the meantime, someone has stepped on the atomizer and broken it. So we're going to use a safety needle, and you pop on the safety needle, pull off the cap, and it looks pretty much like a regular needle, and we're just going to inject right through their clothing and give them 1 cc of Narcan. And then, once I've pulled the needle out, you don't want to put the cap on because you might stick yourself. So on the safety needle, I'll put it up here next to the shirt. What you do is you take your thumb and push the plastic guard over, and now it's capped and it's safe. And lay it down. And that's it. So EMS has come and taken the patient to the hospital. They've left everything here on the floor, and at this point, before you dispose of it, you want to put your gloves on, and these can be difficult to get on. So one thing you can do is put a little breath in it and swing it and inflate the glove, and that usually makes it easier to get out. Okay, so I put both my gloves on. I've got the mask. The mask has to be put to the side and disposed of separately, but everything else can go in this container. So I have my safety needle. Again, I don't have to worry about the tip. I take it apart, throw it away, take off the atomizer, throw it in, and any unused needles, and make sure they aren't uncapped before you touch them. Put them in, and I can even finally take off my gloves, and everything fits in here, and this has to be disposed of separately, and everything in here should be disposed of.